Hello everyone, today we are here to discuss about subchorionic hemorrhage. So let us first know what is subchorionic hemorrhage. So in order to know that, we'll split the word into three halves. There is sub, chorionic and hemorrhage. Sub means in between, and then the thing which comes as chorion. Chorion is the outermost fetal membrane around the embryo in mammals, birds or reptiles. And the next word is hemorrhage. Hemorrhage is in general means excessive bleeding from a damaged blood vessel. So, in general, subchorionic hemorrhage or hematoma or bleeding is a collection of blood that forms between the uterine wall and the chorionic membrane during pregnancy. So, as we can see in the picture below, subchorionic hemorrhage is present in between the uterine wall and the covering layers around the baby. Initially, it is not related to the baby. It is present in the layers which is attaching the baby to the mother. So let us know how do we find out about subchorionic hemorrhage. Usually in a subchorionic hemorrhage, there is presence of vaginal bleeding that occurs during pregnancy. So, in order to rule out any miscarriage or ectopic pregnancy or infection, usually USG, which is ultrasonography, is performed to determine the size and location of the bleeding. So let us know how do we assess the size of hematoma. Hematoma can be considered large if it is greater than 50% of the size of the gestational sac, and medium if it is 20 to 50%, and small if it is less than 20%. So gestational sac is the sac in which the baby is present during the pregnancy. Now we'll learn about how many pregnant women suffer from subchorionic hemorrhage. So out of 100%, usually subchorionic hemorrhage is present in 18 to 22% of intrauterine pregnancies with vaginal bleeding. So the most awaited question is there any impact on the baby or delivery because of subchorionic hemorrhage? So it usually does not harm the baby or fetus, and most pregnancies with subchorionic hemorrhage results in healthy babies. However, some studies shows that subchorionic hemorrhage may increase the risk of adverse pregnancy outcomes such as miscarriage, stillbirth, preterm labor, and fetal or baby's growth restriction. The risk of complication may be higher if the subchorionic hemorrhage is larger, or if it is occurring in the late pregnancies, or it is accompanied by bleeding or cramping. Precautions to be taken are reduction in activities like exercise, lifting heavy objects, avoiding intercourse. The best thing which you can do is complete bed rest. Healthy food will also help you. Don't forget to follow up USG to assess the size of hematoma and consult your doctor. Thank you for watching the complete video. If you have any query, please comment down below. In order to get more informative videos as such, you can subscribe to our channel and press a bell icon.